Secunda Kamani reporting. The world is braced for the economic ramifications of the coronavirus pandemic, but experts say the implications of the mental health crisis that frontline workers are facing cannot be ignored. Research shows that in past traumatic crises, healthcare professionals can suffer depression, anxiety, insomnia and PTSD, and it's suggested that similar problems are likely to arise for many of those directly engaged in diagnosing and treating COVID-19. Shelley Jane is a psychiatrist and author of The Unspeakable Mind, Stories of Trauma and Healing from the Front Lines of PTSD Science. It's really good to have you with us, Shelley. Let's talk first of all about our healthcare professionals, to whom we owe so much. Clearly, they are working under extreme stress every day and they carry on regardless. But at some point, that pressure has to tell.
Yeah, so we know from previous disasters like the Ebola pandemic, from 9/11, from Hurricane Katrina, that up to 20% of first responders and healthcare professionals, essential workers, will likely develop things like post-traumatic stress disorder in the weeks, months and years that follow this pandemic.
And it's not just what they're seeing and witnessing every day, which must in and of itself be distressing, but also, of course, they live with the risk that they themselves might contract the virus.
Absolutely. I think that moral quandary is really at the heart of what makes this so stressful and potentially traumatizing, is that, of course, you're going to look after your patients and you're going to use your expertise to save them, but will it be at the cost of your own health, or will it be at the cost of the health of your loved ones? That is the exact quandary that is causing so much stress. You
spoke of previous pandemics, epidemics, like Ebola. What was the good practice that we developed? What did we learn from those instances?
So in Ebola, we recognize that part of the way healthcare professionals operate is they carry on and defer. So in the moment, they do what they need to do to save their patients. They really hyper-focus, they concentrate, and they delay the processing of emotional and psychological consequences. Part of the issue with COVID-19 is that how long are people supposed to keep on deferring? Because this is a chronic, evolving pandemic with no end in sight. So I think just making sure that defer does happen at some point, and people do process the emotional and psychological consequences when the time is right to do so. I think that's key. And then having access to the social support networks that can help them bounce back.
And imagine that's encouraging each other, because I've done some reporting out in the field and seen it firsthand. Health workers are very good at looking after one another, but they're not that good at looking after themselves.
Yep. Yeah, absolutely. So the strength of the bonds between peers are really strong. We can't underestimate that. You know, no one understands what you've been through quite like someone else who's been through exactly the same thing. So I think encouraging those bonds, obviously, when you're dealing with the loss of colleagues or colleagues have gotten sick, that gets complicated. But yeah, you're right. Healthcare professionals, they're trained to take care of other people. They spend a lot of time putting the needs of others ahead of theirs. So it can take them a while to figure out, oh, okay, I need help now and I need to focus on myself.
Can we talk about the general public at large? There's some interesting studies that have been done. One that's been reported today from the Office of National Statistics here in the UK. And a large percentage of people in lockdown are more worried about their mental well-being than they are necessarily about the virus.
Well, yeah, I mean, economic concerns, I think, is a massive one. We know when there's big unemployment rates, we know when there's a recession, that there's a massive increase in mental health disorders, and a lot of that stress trickles down, and you can see increase in episodes of family violence and intimate partner violence. But also, if you have pre-existing issues with anxiety and depression, these can get exacerbated by these stresses because your normal, natural, healthy ways of coping have been impacted. You know, you can't go to the gym anymore, you can't go out and see family and friends, and so people are kind of bracing for the fact that they have to adapt to these new circumstances.
Yeah, so important we recognise it and talk about it to one another. Shelley Jane, really lovely to have you on the programme. Thanks very much for your thoughts.
Thank you. Stay